Hello everyone, welcome to our channel. Today, we will be discussing rheumatic heart disease. Rheumatic heart disease is a condition that affects millions of people worldwide. It is a serious condition that can lead to heart failure and even death if left untreated. So, if you or someone you know has been diagnosed with rheumatic heart disease, or if you are simply interested in learning more about this condition, then this video is for you. We will be answering all of your doubts about rheumatic heart disease, like the cause, symptoms, treatment and much more. But before we begin, please make sure to subscribe to our channel and hit the like button to show your support. Rheumatic heart disease is a condition that occurs when the heart valves are damaged due to rheumatic fever. Rheumatic fever is a complication of untreated strep throat or scarlet fever caused by the Streptococcus bacteria. If left untreated, rheumatic fever can cause inflammation in the heart, leading to damage of the heart valves. Rheumatic heart disease can affect people of all ages, but it is most commonly seen in children between the ages of 5 and 15. The symptoms of rheumatic heart disease may not appear until many years after the initial infection. Common symptoms include shortness of breath, fatigue, chest pain, and heart palpitations. If you suspect that you or someone you know may have rheumatic heart disease, it is important to see a doctor as soon as possible. The main cause of rheumatic heart disease is rheumatic fever, which is caused by the Streptococcus bacteria. This bacteria can cause strep throat or scarlet fever, which if left untreated, can lead to the development of rheumatic fever. When rheumatic fever develops, it can cause inflammation in the heart, leading to damage of the heart valves. The exact reason why some people develop rheumatic fever while others do not is still not fully understood, but it is thought to be related to genetics and environmental factors. Other risk factors for rheumatic heart disease include living in poverty, overcrowding, and poor sanitation. The symptoms of rheumatic heart disease can vary depending on the severity of the condition. Some people may have no symptoms at all, while others may experience shortness of breath, fatigue, chest pain, and heart palpitations. In severe cases, rheumatic heart disease can lead to heart failure and even death. It is important to see a doctor if you experience any of these symptoms or if you have been diagnosed with rheumatic fever in the past. How is rheumatic heart disease diagnosed? Rheumatic heart disease is typically diagnosed through a physical exam, medical history review, and diagnostic tests such as an echocardiogram, electrocardiogram, and chest X-ray. During a physical exam, your doctor will listen to your heart for any abnormalities and may also check for swelling in your legs or abdomen. They will also ask about your medical history and any symptoms you may be experiencing. Diagnostic tests such as an echocardiogram, electrocardiogram, and chest X-ray can help to confirm the diagnosis of rheumatic heart disease by showing any damage or abnormalities in the heart. Blood tests may also be ordered to check for signs of inflammation or infection. What are the treatment options for rheumatic heart disease? The treatment for rheumatic heart disease depends on the severity of the condition. In mild cases, medication may be prescribed to help manage symptoms and prevent further damage to the heart. Antibiotics may also be given to prevent infections that can lead to further complications. In more severe cases, surgery may be necessary to repair or replace damaged heart valves. Lifestyle changes such as a healthy diet, regular exercise, and quitting smoking can also help to improve heart health. Can rheumatic heart disease be prevented? Yes. Rheumatic heart disease can be prevented by treating strep throat or scarlet fever with antibiotics. It is also important to maintain good hygiene and avoid close contact with people who have these infections. Regular checkups with a healthcare provider can help to detect and treat rheumatic fever early, before it leads to heart damage. Additionally, living in a clean and healthy environment with access to proper sanitation and nutrition can also help to prevent rheumatic heart disease. What is the prognosis for rheumatic heart disease? The prognosis for rheumatic heart disease depends on the severity of the condition and how early it is diagnosed and treated. With proper treatment, many people with rheumatic heart disease are able to live a full and healthy life. However, in more severe cases, the damage to the heart valves may be irreversible, leading to long-term complications and a poorer prognosis. It is important to work closely with your healthcare provider to manage your condition and maintain heart health. Is rheumatic heart disease contagious? No. Rheumatic heart disease itself is not contagious. However, the Streptococcus bacteria that can cause rheumatic fever and ultimately lead to rheumatic heart disease can be contagious. It is important to practice good hygiene and avoid close contact with people who have strep throat or scarlet fever to prevent the spread of these infections. Who is at risk for developing rheumatic heart disease? Anyone can develop rheumatic heart disease, but it is most commonly seen in children between the ages of 5 and 15 who have had untreated strep throat or scarlet fever. Other risk factors include living in poverty, overcrowding, and poor sanitation. Additionally, some people may be genetically predisposed to developing rheumatic fever. What are the long-term effects of rheumatic heart disease? The long-term effects of rheumatic heart disease can include heart failure, stroke, and death. The damage to the heart valves caused by rheumatic fever can lead to complications such as blood clots, infections, and heart rhythm abnormalities. It is important to manage the condition and maintain heart health through lifestyle changes and regular checkups with a healthcare provider. We hope that this information has been helpful and informative. If you or someone you know has been diagnosed with rheumatic heart disease, it is important to work closely with your healthcare provider to manage the condition and maintain heart health. Don't forget to subscribe to our channel for more informative videos like this. Thanks for watching us.